So let's talk about the classes that you're going to be taking in the respiratory therapist program. First, you need to understand that this is a difficult program. You are going into a health career, a medical program. So you have to know how to take care of critically ill patients and to make the correct decisions. You can do things that will actually kill patients. We give medications, we run life support. If you would blow up the patient's lungs, they don't have another set. So you have to know not only what you're doing, but why you're doing it. And that's where a therapist versus a technician comes in. You are being trained as a respiratory therapist. So you have to be able to think, you have to apply various scenarios and pull all of this information together. A technician is someone who just goes in and says, okay, I just push this button, and then walks out. So again, you have to know the why, not just the what. In order to do all of this, you will put in lots of time for study and for clinical. Make sure that you understand what your typical lecture and lab class schedule looks like. So for us, we kind of do the lecture in the 9 to 3-ish range. There could be late afternoon or evening classes. You would know about that well in advance. I'm not a big fan of 8 o'clock classes, so you don't have to worry about that. The class size also plays a factor, and the availability of the instructors for teaching the class. You must attend lecture and lab classes. It is stated in your syllabus that if you miss more than 15% of the class time, the instructor can remove you from the roster because it would be too difficult for you to make that time up and stay current in what we're teaching. Also, when we're lecturing, we're not just doing lecture, we're demonstrating. So we're demonstrating pieces of equipment, we're demonstrating procedures as we're talking about them. So if you're not there, you miss that. The typical clinical schedule, you start in the hospital in the summer semester. So the very first semester that you're here, in the spring, you are going to be taking foundation classes. Then once you start in the summer, you will be taking actual clinical courses. Clinical is 2 days a week, and that is the entire time that you are in the program. You will have clinical 2 days a week. The other days, you will have lecture. So you will be here on the days you are not in the hospital. Clinical usually runs day shift, which is 6:30 to 1 p.m. However, depending on the size of the class and availability of instructors, there could be an evening shift clinical. Those usually run 2:30 to 9 p.m. You do not get to choose where you go to clinical. We assign you, and you will rotate through various clinical sites. So, let's talk about those clinical sites. Currently, we use UPMC Harrisburg Hospital, UPMC West Shore Community General Osteopathic Hospital, Penn State Health Hershey Medical Center, Penn State Health Holy Spirit Medical Center, and Lehigh Valley Jefferson Cedar Crest, which is in Allentown. We also occasionally use various other local hospitals. It depends again on the size of the class and what material needs to be covered in clinical. So you need to understand that you are going to be traveling. So from wherever you live, you're going to be moving around. we rotate you through these various hospitals so that you can see how things are done at different institutions. So you may have to travel 80 miles from the Harrisburg campus just to go to your clinical rotation. There is also one night shift rotation. That is done for sleep studies, and that is from 7 p.m. to 1 a.m. But that's one day, and you'll know about it like a semester in advance. When you are considering yourself doing clinical is not just hospital work. Okay, there's lots of times that you're going to be applying things or doing things that we count as clinical work. An example, there may be special rotations where you're going out and you're doing or seeing things at various hospitals. We have an ALS day here at HAC. ALS is Lou Gehrig's disease, and what happens is these patients come in to our dental hygiene clinic and get their teeth cleaned. They are all at risk for aspiration. Sometimes those patients come in on ventilators. So the respiratory students work closely with the dental hygiene students to monitor and care for those patients. You may need to come in and do some extra lab or equipment time. So you need to come in and work on things. We kind of consider that as a clinical type scenario. And any other things that come up. So we get requests sometimes for people to go and talk to elementary school kids about the respiratory system and the lungs and those types of things. And we will talk about that if those come up. I try to get volunteers, but you'll go out and you'll talk to them. We have open houses and tours, or we have students that come in from high schools to the college, and we will have students participate in that so that you're learning how to pass your education on, how to be an instructor, how to work with other people. However, this could affect your financial status. Because you are not a full-time student, unless you are taking 12 credits, you are eligible for financial aid because there is at least 6 credits of respiratory in each semester. But you need to keep that in mind. While it's only a 2-credit class for clinical right now, you will be spending 12 hours a week in the hospital plus other time. That includes competency testing. Before we can turn you loose out onto real live patients, we have to make sure that you are competent to perform these procedures or work with these pieces of equipment. Competency testing is done outside of your normal lab time, if possible. And competency testing is required, and you have to pass those competency tests. So we try to build it into your schedule when possible, but we let you know at the beginning of the semester, here's when we plan to do competency testing, so you need to make yourself available for it during those times. Before you come to the competency test, you are going to be peer tested. That means you're going to be testing each other. So this gives you a way to kind of test each other, that you know what you're doing. If you can explain it, or if you can catch what somebody else is doing wrong, then you truly do understand the procedure or the equipment. Peer testing is also done outside of lab time, and it is also required. Then there's open lab time. you need to come into the lab outside of regularly scheduled times to practice with the equipment, to practice with the procedures, to get you ready for your peer testing and to get you ready for your competency testing. So when students are struggling, one of the things I'm going to look at is how much time are you spending in the lab. Now you can be in our lab anytime there is not a class scheduled in there or I've not had to close it for some reason. It's your space, but you will definitely need to take advantage of that space. Now let's talk about the types of classes that we're looking at. Of course, there are lecture classes. There is also lab classes where you're going to be working with the equipment and practicing the procedures. There are clinical courses, which basically is where you're going to be at the hospital. There are some online courses. So you're currently taking an online course, but the Respiratory 150, which is pharmacology, is also an online course that you will be taking while you're in the program. We also have blended courses. The blended course that we teach right now is Respiratory 160, Patient Assessment. A blended course means that you will spend part of your time in class with an instructor, and you will spend part of your time outside of class doing work virtually. We also use what we call mini-mesters. The course you're taking right now is a mini-mester. It is offered in a 7-week semester. So it is a little bit more intense. It requires a little bit more time. However, we use these smaller, more condensed semesters in order to prepare you for things that are going to be coming after that. Example, you will take Respiratory 200 is now an online class. I forgot to add that into this PowerPoint. So Respiratory 200 is an online class. Well, which is disease states. You have to know the assessment piece, which is taught in 160, before I can teach you about the diseases. Because when we're talking about diseases, we're going to be talking about breath sounds, we're going to be talking about EKGs, we're going to be talking about x-rays, we're going to be talking about lab values. Those things are all taught in the first 7 weeks of the semester. So that's kind of why we use this. Also, in some of the other core classes, you will take your clinical, which will be the entire semester, but you may take your course in the first part of the semester. This means you have the rest of the semester to practice and get competent on all of that material on real patients. So in the next video, we're going to look at the actual classes that are required, and we'll discuss when you take what classes.